Hey everybody, I'm DJ Sixsmith. You're watching The Sit Down. Dr. Orna Guralnik is here with us. It is a brand new couples therapy COVID-19 special coming to Showtime. Dr. Guralnik, how are you?
Hi, I'm good. Thank you for inviting me.
You got it. So we chatted last year and it was really interesting picking your brain and learning about all the different couples that you got to meet and you got to work with. This year was much different because you started meeting with the couples in person. COVID hits, you have to do everything through Zoom. So what was it like putting this special together for Showtime?
Very interesting. I mean, that was not the plan, the special. We started with season two, filming season two, which was a very interesting beginning, just the usual beginning of like intensive work with couples. And very few weeks into filming, life was normal. Suddenly the pandemic hit, and in the beginning, like everyone else, we were like, "Wait, what's going on? Is this real? Are we really?" And suddenly, boom! It was lockdown, and we had to change everything. So we we changed what we were doing with the show, but the team of directors I'm working with, this amazing team, I mean, they're true documentarians, and they were like, this is a historical moment. We need to like capture this because there's nothing like this. So that's how suddenly the special became a thing. It was not in the plans. Um, so we went back to couples that we worked with in season one to check in on them, worked with a few new couples, and that's how it came about.
Yeah, I thought it was really interesting just looking at the footage. I mean, even people shopping without masks and looking in New York City and what it was like before everything got locked down and when we first got locked down. I mean, so much has changed in,
So
eight,
much.
9 months. It's really crazy when you think about it, right?
Crazy. It's crazy how much has changed. And what's also crazy is how long it's going on.
I know.
It's just going on and on.
Yeah.
So
And,
many forms of craziness.
we're going to go into it next year as well. And at least we've adapted with Zoom and conversations like this. But for a lot of these couples, they have to face the problems every single day as opposed to the problems
Yeah,
just when they were coming into your office. So,
right.
what have been the biggest challenges for the couples that you worked with this year?
Challenges that are particular to this situation, to the pandemic and to the lockdown. I mean, there have been a bunch of pretty intense challenges. Of course, one thing is the actual challenge of the pandemic, right? So people losing jobs or jobs changing, and a lot of anxiety and uncertainty as to living. Like, where is the money going to come from? Are we going to be able to live in the same place? People have moved a lot in response to circumstances. The illness and proximity to death. People have died. Parents have been very ill. And just the proximity to death has been very challenging and evoked very different responses in different people. People respond to this kind of threat and anxiety very differently, which has brought up a new source of difference and tension between couples that they've had to deal with. Some people are more comfortable taking risks and seeing friends. Other people are very strict and nervous and, spend a lot of time just wiping down products that come from the grocery store. People are really different that way. And they're different in terms of what they need when they're anxious. Some people need a lot of space when they're anxious and they don't want to be talked to. They need a lot of time for contemplation. Other people want to be together and support each other literally by holding on to each other. So many sources of difference have been evoked or provoked by this pandemic.
How about for you
And then
personally?
there's, sorry?
How about for you personally? Because even you've had to change your routine, right? And you have, your kids and your animals and all that. And
I've had
even
to
like
change
your
so much.
Yeah, I mean, even your check-ins with Dr. Gardner that you used to do in person, you're doing on Zoom. So how has your life changed?
But it's changed very dramatically. I've had In terms of my practice, obviously moving to Zoom rather than being at my office. So I'm not going to the office and I'm not seeing people in the office. So we're not commuting and together in a certain space and then partying. We're at home on Zoom. So I mean, especially for a psychoanalyst, that's a very big change of frame, and it kind of destabilizes and messes with very basic things that I typically rely on. And then there's sort of the giving up of privacy. Like people are in my home, there's like, there I am at home. And my pets are around, and my kids sometimes mistakenly enter the frame, or, Amazon delivery at the door. It's been a lot. And then, I have one kid home from college with her boyfriend, another kid homeschooling. We've had other people that have had to stay with us because of all sorts of situations. So it's been a really full house. And trying, like everyone else, trying to carve out space to like do my sessions with no one intruding. Um, it's been pretty intense.
Yeah, it's been a
Wonderful
crazy
also, but
it's been a
also
crazy year. I mean, whether you're
crazy.
working or you're not working, I mean, it has been insane. And for these couples too that are trying to work through some stuff, I mean, it's already hard enough to build a marriage and foster a meaningful relationship. To do it in this year is even more challenging. So just, kind of break it down for the couples that you worked with in the past versus the new couples this year. What were some of the things that you really wanted to focus on given all the other challenges going on?
Well, I'm not going to respond directly first to that question. Let me just first say something in general about everyone, which is that, meaning old couples, new couples, just couples that are going through this. Um, One of the interesting things for a couples therapist to witness during this is that because of the lockdown, couples are forced into this kind of no exit situation. And typically, people like to, when things get tough, they like to take a break. They like to avoid whatever is causing them discomfort. The one thing couples like to do is just either have a big fight so that they can walk away, or just walk away, or go to work, or get on their phone, or just avoid situations of discomfort. And this lockdown situation has forced a certain kind of no exit situation for couples, which both turns on the heat, and it can create certain kind of artificial stressors just by the fact of being together all the time. But it can be a very positive thing for couples because you're being called into being present and figuring it out. There's no more postponing it or dropping it or walking out on it. You got to deal and you got to face it and work through some of the stuff that's been difficult for people. And that's been terrific. It's been terrific to watch people do that. Um, and as far as your question about couples from before and new couples, um, not much of a difference. This pandemic has been kind of a new chapter in everyone's life. It's forced kind of a new reckoning with lots of things that get kind of shoved under the carpet in regular life. Did
Yeah.
that answer your question?
I don't know. Absolutely. Yeah. I mean, listen, we all have to confront it. And even what you were saying before about how you kind of feed off the intimacy of a couple when you're just with them in person, you have to try and figure out what that looks like over Zoom. So there's obviously challenges over Zoom, Doctor, but what were some of the surprises that were actually positive when you were doing some of these sessions over Zoom?
Lots of good surprises. One of the things I've loved about Zoom um, are the pets. I love hanging out with everyone's pets. That's like the typical cat tail that walks across the screen. I just love it. Never get enough of it. Um, I've loved being in people's homes. I actually like getting to know their homes and the very funny places people make Zoom calls from. I love it. I mean, people have talked to me from their bathrooms. They've talked to me. I mean, the funniest was somebody had a session with me in a clothing closet under the clothes. So the clothes are above head. It's just great. It's just so wonderfully human. And some people that are typically late to sessions because, you know, they just can't manage their time or they're passive aggressively late. I mean, nobody's late anymore.
True.
We're all on time. There's no commuting. I mean, we're just here. So I get to have full sessions with people, which is great. Um, and even though it's been tough for me to give up my own kind of anonymity and privacy and neutrality, it's also been good to have this kind of intimacy with people, knowing that we're all from home. I think it helps because it's such a challenging time and in many ways very difficult. So I think it's been a good thing to add in that level of intimacy. So it's been good, and it's been good to work in sweatpants.
It's not a bad deal either, right? Yeah, I think you make a really interesting point because, you know, even seeing your bookshelf and your pets, that just helps in creating a universal experience. And, you know, we're all dealing with the
Yeah,
same thing. I'm sure when people come into your office, it can be intimidating and daunting, but now
right.
it's just like, hey, I'm going to put on my sweatpants and I'm going to talk
I
about my
know,
marriage. Like this is where we're at.
right. Yes, it's sort of a great equalizer.
Absolutely. When you think
Yeah.
about what you did with season one and also season two, you've obviously been doing this work for a super long time, but to put this on TV, to get it out to the masses, what are you most proud of in terms of what the show represents overall?
Um, honestly, I am really proud of this project, really proud of it. Proud that, I mean, I'm working with an incredible team. I mean, these people are, I mean, I'm so blessed to be working with these directors and editors. They're just everyone on the team. I mean, everyone, just really good people that are committed to the good thing, committed to sort of putting on screen the intimacy and dignity and struggle of human life in the best possible way without sensationalizing it, without distorting it, but really putting it out there for us all to connect to each other, to understand what it means to be human and how to try to make something better out of the difficulties we're in. Um, so I love that about the project, that it's really everyone's heart is in the right place. And I also love being able to put on the screen, like in the middle of like just regular TV consumers, psychoanalytic thinking,
Hmm.
which is typically, you know, held back in like some kind of ivory tower, you know, in our private offices. But psychoanalytic wisdom for the people, that's great. I mean, it's good for everyone. So I'm happy with that. And we tackle very sensitive topics, you know, issues that have to do with class and race and political difference and all the intense stuff, the way it plays out in the very intimacy of a couple's life. We manage to deal with super big issues in a very delicate, intimate way so that people can feel part of it and take something from it. And I'm really proud of it.
You should
So
be. You've done tremendous work with this show. And like you said, everything's on the table and there's something for everybody. And I think people will really enjoy the special here. So, Dr. Guralnik, thanks so much. Stay safe, stay
thank you.
healthy, and hopefully we can
Thank
do
you
this in
so
person
much.
next year, all right?